the point that you touched upon there is being doctors, UK trained GPs, and functional medicine or personalized medicine physicians allows us to really navigate traditional disease methodology with a personalized approach, which means that we can really truly tailor the best approach for you. We've been working on creating that integrated care team approach where every patient gets not just one of the doctors working with them, but they also get a dedicated functional nutritionist. Tell us about how powerful that is and why we do that at HUM2N.
So the functional nutrition element, I would say, is really crucial for the success of the health program or the health journey, because ultimately when we're applying the methodology, we're looking at certain dietary changes. So for some people it could be something simple like going gluten dairy free for a little while, but there are some really other powerful kind of dietary changes that we can implement. So going back to autoimmune conditions, there's a fantastic diet called the Autoimmune Protocol, but that requires the help and support of having a trained functional nutritionist to guide you through it. And there are other diets, so even when you're thinking about fungal overgrowth, there are specific carbohydrate diets, there are other diets that we can consider that will really help minimize fungal overgrowth. But these diets can be challenging to implement without guidance, but also kind of having that coach, having that support system. So again, taking back to my personal kind of journey, I found having a coach, having a guide really powerful and impactful in making those changes. And so having your functional nutritionist, but they're also there as your coach, as your guide, can really help kind of move the needle with some of the lifestyle practices that you need to implement essentially.
That's right, and make it practical, make it doable for our patients. Every patient is different in terms of the actions they can do, what their home life is like, and what their work life is like. And so I found that the ability to have that accountability, but also the support to make it practical and achievable. And it allows us as the doctors to do the strategy in terms of the blood work and the interpretation, and then the functional nutritionists to work together where they can help implement those lifestyle changes, the supplements, and hold them through that journey. And it works really, really well. And then we're lucky because we have curated a suite of therapies here at the flagship, which also kind of expedite the jetpacks, I call them, to expedite results based on real understanding of what biological processes we can support. Our intravenous nutrition range, very specific formulated IVs, intravenous ozone therapy, hyperbaric oxygen therapy, cryotherapy, all of these work on different biological systems, but we prescribe them to get the results faster for our patients. And I personally see this as the future of the GP centers. This is what we're working towards here at HUM2N. We see the kind of community care delivered in this prescriptive, scientific, integrated, handheld, but holistic way, because the range and breadth of conditions that we're treating in this methodology and the improvement in quality of life and the prevention of decline, most importantly, is second to none in the practicing medicine I've experienced to date.